I wasn't lying!
When they took their dog to the vet to get his nails trimmed, he was not having it, and the way he whips his head back getting ready to chomp at her is hilarious.
You see, petting your dog is one of the most relaxing things you can possibly do.
It's more common than you might think. You're reaching to pet a dog, separating two kids on the playground, or just minding your business at a family barbecue. Suddenly, teeth or claws break skin. Now you're dealing with a bite wound. Most people freeze in these situations, but the truth is, what you do in the next few minutes is what matters most. I'm Dr. Yomi Adeyemi, a board-certified urgent care physician, and today I'm walking you through exactly what happens when someone comes into urgent care with a bite, whether that be a dog, a cat, or even a human. Who's really at risk? When should you be worried about infection or rabies? And are antibiotics always necessary? We're going to break down the facts, bust the myths, and give you the real science, so you know exactly what to do if it ever happens to you. Hey guys, really quick before we jump into the video, I just want to say that, believe it or not, more than 90% of you guys watching this video right now aren't subscribed. I want to continue bringing you guys high quality content here on the channel, and to do that, we need your support. I'm not sponsored by any big industry names, and everything we do here on this channel is supported by you guys. So if you subscribe now, my commitment to you is that me and my team will continue doing everything in our power to bring you guys the highest quality content. Thanks for listening. Let's get into it.
A vicious dog attack caught on camera is renewing calls for a change in city laws.
Now let's talk about how common this really is. See, every single year, more than 4.5 million Americans get bitten by dogs. That's nearly one person every 7 seconds in this country. Cat bites and human bites don't make the headlines as often, but the danger is real. In some ways, even higher. Cat bites have a higher risk of infection than dog bites. And human bites, especially those that break the skin, can lead to serious deep tissue infections. Now, here's what most people miss. It's not always the size of the bite that causes the problem. Even a small puncture, if it's in the wrong spot or from the wrong animal, can turn into a massive medical issue fast. We're talking skin infections, deep abscesses, damaged tendons, and in rare cases, life-threatening sepsis. And some of the worst infections don't even look that bad at first. Most of the danger comes from bacteria, millions of them, living in the mouths of animals and people. When those bacteria get pushed under your skin, they find the perfect place to multiply. That's why, in urgent care, we take every bite seriously, no matter how minor it looks on the surface. Now, dog bites are the #1 animal bite we see in urgent care. Most of the time, it's not a stray, it's a family pet, a friend's dog, or a neighbor's animal. Now, why are dog bites dangerous? First, the mechanics. Dog bites don't just break the skin. They can crush and tear tissue, making wounds deeper and messier than they look on the surface. Next, there's infection. About 5 to 20% of dog bites develop an infection, even with good washing and care. That's because dog mouths are loaded with bacteria. I know, shocker. The big three we worry about are what are called Pasteurella multocida, Staphylococcus aureus, and Capnocytophaga canamorsis. I hope you guys appreciate these mouthfuls. When you show up in urgent care, here's exactly what I'm thinking as a physician. First, how deep is the wound? Is there a puncture or crushed tissue? Are there any muscles, tendons, or joints involved? How old is the bite? More time means more infection risk. Is the dog vaccinated for rabies? If not, we may need to consider rabies shots. And remember, bites on the hand, face, or over a joint, well, those are at high risk and need special attention. Even if a wound seems small, it can hide big problems underneath. Now, let's talk about cat bites. And yes, you can cue that Ted Nugent riff in your head, if you must. But here's what most people don't realize. Cat bites are often worse than dog bites when it comes to infection. Why? Well, cat teeth are particularly sharp and needle-like. They inject bacteria deep under your skin, and the tiny entry wound seals up quickly, trapping germs in place. More than 50% of cat bites become infected. That's way higher than with dogs. The usual culprit is a bug called Pasteurella multocida, which can cause serious pain, swelling, and in some cases lead to hospitalization. And here's a bonus risk: cat scratch fever.
Cat scratch fever.
Now, that's not just a song. It's a real disease caused by Bartonella hanseae, usually from a scratch, but sometimes from a bite or even a lick. Symptoms can include fever, swollen lymph nodes, and feeling generally run down. Rarely, it can get much more serious, especially in people with weak immune systems. So, if you get bit or scratched by a cat and you notice any redness, swelling, warmth, or you start to feel sick, do not wait. Get medical care right away. Cat bites are small, but the risk can be huge. Now let's talk about human bites. These don't get the press that dog or cat bites do, but in the urgent care world, they're some of the dirtiest wounds we ever see. You see, human saliva is like a zoo. Over 700 different types of bacteria living right in your mouth right now. And that's actually more than you'll find in most dogs' mouths. So, when someone breaks the skin, whether in a bar fight, during sports, or by accident at work, those germs get a one-way ticket into your tissues. The classic example, a fight bite.
Come on, hit me before I lose my nerve.
That's when someone punches another person in the mouth and their knuckles get cut on a tooth. The wound might look tiny, but bacteria get trapped deep in the hand, right over joints and tendons. Within a day or two, it can balloon up, leading to swelling, pus, fever, and even loss of hand function. If you wait too long, these infections can destroy joints, spread through the bloodstream, or even require surgical debridement. And here's what we find growing in those infections. Acanella corrodens, which is classic for human bites and hard to treat. Streptococcus species, Staphylococcus aureus, plus anaerobes and a bunch of other nasty bacteria. What's worse, some of these bugs don't respond to typical antibiotics, so you need medical care and sometimes IV medication fast. If you ever get bitten by another person, especially on the hand or over a joint, don't mess around. Wash it well and go straight to urgent care or the ER. The infection risk is serious and the complications, they can be permanent. Now, do you always need antibiotics for a bite? Not always. Let's talk about when you definitely do. Deep puncture wounds. These can inject bacteria deep into tissues, making infection much more likely. Bites to the hands, feet, face, or genitals. These areas are higher risk due to poor blood supply or proximity to vital structures. Any sign of infection, we're talking redness, pus, swelling, or fever, these are red flags that bacteria are already spreading. Immune compromise. If you have diabetes, HIV, cancer, or are elderly, your body's defenses aren't as strong and you're more likely to get an infection. Delayed treatment. If you wait more than 12 hours after the bite or 24 hours for bites to the face to seek care, your infection risk goes up significantly. For most bites, especially those on the hand or face, or if there's any doubt, we prescribe antibiotics, most commonly amoxicillin and clavulanate, also called Augmentin. But here's a myth buster for you. Not every bite needs antibiotics. For otherwise healthy adults, if it's a very minor superficial dog bite to the body, not the hand or the face, and it's cleaned right away, research shows that antibiotics don't make much of a difference in preventing infection. That means a small scratch on your arm or leg, if cleaned immediately and not showing any signs of infection, might not require a prescription. But even then, every situation is different, and it's always safest to let a medical professional make that call. Don't self-prescribe. For all but the tiniest, cleanest wounds, see a doctor for advice and treatment. Now, the scariest bite scenario is rabies. Here's the truth. In the US, rabies in dogs and cats is rare, but not impossible, especially in unvaccinated or stray animals. The real danger is from wild animals. We're talking bats, raccoons, skunks, foxes. So, when do you need a rabies shot? If the biting animal is wild, stray, or unvaccinated and can't be observed, if the animal develops signs of illness or disappears, we almost never give rabies shots for vaccinated pets that are healthy and can be quarantined for at least 10 days. Now, first aid makes a huge difference. If you get bitten, whether it's a dog, cat, or human, what you do in the first 10 minutes can change everything. Step 1, rinse it. Get that wound under cool running water immediately. Don't wait, don't worry about making a mess. Use lots of water. If you have mild soap, gently lather around, not inside the wound. Don't scrub, don't use a brush, and never squeeze the bite. It can force bacteria deeper into your tissues. Step 2, let it bleed a little, unless it's severe. Unless the blood is squirting or pulsing, a little bleeding can help flush out germs. If it's bleeding too much, use a clean cloth or sterile gauze and apply gentle, steady pressure until it stops. Step 3, cover it. Pat the area dry with a clean towel, use a sterile non-stick bandage, or clean gauze pad. If you have antibiotic ointment like bacitracin or polysporin, you can apply a thin layer of that on right before bandaging, unless you're allergic, of course. Step 4, elevate it. If the bite's on an arm or leg, keep it raised above heart level to reduce swelling and throbbing. Step 5, seek medical care for deep wounds, wounds on the hands, face, feet, or genitals, bites from wild animals or any animal you can't verify is vaccinated. Any sign of infection, redness, warmth, swelling, pus, or fever, if you haven't had a tetanus shot in the last 5 years. And remember, if it's a bite to the hand or face, a deep or dirty wound, or you're not sure if you need help, go to urgent care or the ED. It's not worth the risk. Here's a pro tip. Never try to close up a bite wound with glue, tape, or DIY stitches. Most bite wounds are not stitched closed immediately. They're left open on purpose to reduce infection risk. Take wound care seriously. What you do at home could be the difference between a quick recovery and a dangerous infection. Now, when you show up at urgent care with a bite, here's what you can expect, step by step. First, assessment. We'll carefully examine the wound, how deep it is, what tissues are involved, where it's located, and any early signs of infection like redness or pus. Next, cleaning. Even if you cleaned it at home, we'll clean it again, sometimes using special solutions or irrigation to flush out bacteria. For deeper wounds or those that might be hiding debris, we may numb the area and gently explore to make sure nothing's trapped inside. Antibiotics and stitches. If there's a high risk for infection like a bite on the hand, face, or a deep wound, we'll prescribe antibiotics. Most bite wounds don't get stitches right away because closing them can actually trap bacteria and raise the risk of infection. If the wound is bleeding badly or on the face, sometimes stitches are used, but it's always a careful decision. Tetanus and rabies. If you haven't had a tetanus shot in the last 5 years, we're going to update it. And if there's any risk of rabies, like an unknown or unvaccinated animal, we'll start the rabies protocol and report the bite for public health follow-up. Documentation. We document everything, including details about the animal, vaccination status, and the circumstances of the bite. This helps with public health reporting and, if needed, tracking rabies or other zoonotic risks. The bottom line here, you'll get a thorough check, targeted care, and a plan to prevent infection or further problems. If you're ever unsure, come in. We've seen it all, and it's better to be safe than sorry. So, if you or someone you know ever gets bitten, don't panic. Wash it, get medical care, and don't take chances with infection or rabies. You got questions about bites, urgent care, or anything else health related? Drop them in the comments. Subscribe for more real medical answers, and hit that bell so you never miss a myth-busting episode. I've been Dr. Yomi Adeyemi, and this has been another episode of Urgent Care Uncovered. Stay safe out there, and as always, stay dynamic. Peace.